Hello and welcome to this evening's Diagnostic Imaging webinar. My name is Lydia Morgan and I'm the Senior Commercial Manager here at Virtual Veterinary Specialists. At VVS, our goal is simple: to strengthen collaboration between first opinion vets and specialists. We want you to feel confident tackling every case, knowing that you have a supportive, experienced team of specialists working alongside you. With our collaborative teleconsultation and live guided consultation services, you can deliver referral level care right from your own practice. Cases include 6 weeks of follow-up as standard, ensuring both you and your patients have continued support. Whether it's real-time ultrasound guidance or case discussions, our specialists are here to help you manage cases in-house with confidence and continuity. We're delighted to welcome Dr. Cristi Glavan, VVS Diagnostic Imaging Specialist, as our speaker this evening. Cristi graduated in Bucharest in 2018 and moved to the UK shortly after, working in small animal hospitals before focusing his career on diagnostic imaging. His expertise spans ultrasound, CT, and other imaging modalities, and in 2024, he became an RCVS recognised specialist in diagnostic imaging. He's also part of several professional organisations and contributes actively to research, publications, and education. Currently, as well as delivering excellent clinical support for cases at VVS, Cristi works with Mindray as a clinical specialist. Cristi's passion lies in ultrasound, not just performing it, but teaching it. And tonight he'll be sharing his insights into advancing your abdominal ultrasound and how to improve patient outcomes through imaging. This is the first in a two-part webinar series, with the second scheduled for Tuesday, the 28th of October. So sit back, get comfortable and enjoy what I'm sure will be an engaging and informative session, and do join us for the question and answers at the end. So I'll hand over to Cristi.
Thank you for the kind introduction, Lydia. And just a quick test, can everyone hear me okay? Yeah, perfect. Thank you again for the introduction, Lydia, and thank you all for joining the webinar. I hope it will be useful for all of you, and anything that you will want to ask, just please ask at the end. You can also stop me if it's something like you really want to emphasize or really want to ask, but usually the question and answer will have it at the end of the presentation. So I hope you guys enjoy it, and we'll discuss a bit about the let me just stop about the ultrasound basics and knobology and the settings of the ultrasound machine. Why we have decided to do this type of presentation? Because more and more people will ask about the settings of the machine, how they can achieve a better image on the machine, what are the common settings used, and how we can improve our clinical work and our image. Regarding the basics of the ultrasound, I will not stay that long on this type of on those type of physics, so I will not insist that much. We'll just explain a bit the basics so we can all be on the same side. Then we'll head over to the knobology and the settings that we can do. We'll discuss also about some tips and tricks that we can use to improve our image quality, and what we can do with our image. A bit of the agenda today: I will have a declaration of relationship with Mindray. Obviously, I'm working for Mindray as a clinical specialist. We'll discuss about the ultrasound terminology, some basic principles, B-mode imaging, and B-mode parameters that most of the time we'll need to set and we'll need to work with to achieve better image, and the key points in the question and answer section. So as I was saying, and Lydia was saying, I do work also for Mindray, and just a declaration of relationship with Mindray. Basically, there are two separate entities. Yeah, so just so everyone can be aware of that. Regarding the ultrasound terminology, so those are the parts that will mostly be concentrated on tonight: the real-time, the B-mode, the 2D ultrasound. We'll discuss about the gain, focal zone, frequency, dynamic range, persistence, frame rate, and some other settings. The second part regarding the PRF and the Doppler mostly, and the rest of the settings in Doppler, they will be discussed at the end of the month in the second part of this webinar. Why ultrasound? That's a question that everyone is asking all the time, and I do think that we live in in the century where we all have access to all those type of modalities, and quite often everyone is using this as a diagnostic tool and as a main imaging method in daily practice. It's widely used, it's really popular, everyone has access to this nowadays, and compared with other imaging modalities like CT, MR, it has a low cost. Everyone knows this. It's also a bit easier to use and a bit easier to read, let's say it, even if it's user dependent. And we do have multiple application with all those imaging modalities. Yeah, but especially ultrasound can give us a quick diagnostic. Regarding the basic principles of ultrasound, so I will not go that deep into the physics. It's just some basic things that we all need to know once we start doing some ultrasound, and some key explanation. Basically, everything is based on sound waves, and obviously the computer will process everything, but all those longitudinal waves are just sent from the probe, from the ultrasound machines, will just reach the tissue, and they will all come back and form the image on the screen. Yeah, and we do have some different frequency that can be used, and the medical frequency, as you can see here, the medical ultrasound frequency is slightly different than the one that it's commonly here by humans. Yeah, and it's a non-invasive medical imaging, even if the recent research, they can obviously agree and disagree sometimes, and there can be some discussion on this subject. Yeah, but we are using high frequency sound waves to create real time imaging of the internal structures within the body, and it's not something that like radiation is not something that will affect the organs. As I was saying, the ultrasound frequency sound waves, the sound waves, they will be sent from the ultrasound probe to the tissue, and they will be received back and transformed into an image. If you want, I've always imagined this as a ping pong game. Basically, we are sending, receiving, we are sending, receiving, and we'll have the image transform on the screen, and we can all read that image, and obviously it will depend of many other factors as well. So a starting point is the piezoelectric effect, where the crystals will start moving within the transducer, and it will start transmitting the sound waves, and they'll receive the sound waves back. Yeah, so go and return way of transmitting and receiving the sound waves. From the image up to the image formation, as I was saying, so we do have the signal, the propagation and the tissue interaction, echo reception, and the image formation. Yeah, and all of these, they will be dependent of many other factors. I will not, as I say, I will not insist more on the ultrasound physics here. I was just making a bit of a resume, of a review of the basic principles of ultrasound. Regarding the knobology and the settings, I think every time when we start scanning, it's better to be aware of our machine. And I think one of the most important things all the time is just to know our machine properly. And if we don't know what certain things will mean, we can always ask help for that. We can always read the manual. We can also speak with the manufacturer, with the guys that are selling the ultrasound machine. I will always emphasize this type of aspect, because it's really important once we start scanning to actually know the ultrasound buttons and the functions that the ultrasound has. Learn also, I think, learning all the settings, I think it's also quite important to actually know where everything is on the ultrasound machine. Depending of the brand, we do have multiple settings. Pretty much all of them will have the same meaning, but we might find them under different names. Yeah, so make sure that we all know what everything means and how we can adjust the image, yeah, with the function that we have on our machines. Starting with the B mode. So what is B mode, bidimensional mode? Sometimes we will hear the brightness that is the B mode is described as brightness. I don't think it's fully appropriate saying brightness. I think it's just bidimensional mode. So basically the major image that we'll see on our screens. Yeah. So the image that is formed simply when we start scanning, the probe will send the sound waves, it will receive and it will transform everything into an image. That's what we'll see on the screen. And we'll have some different intensities displayed on the screen. Yeah, so different shades of gray. All of those can be made into a diagnostic point. So we can all differentiate different type of echogenicity on the screen, and we can have a bigger picture of what's happening inside. Yeah, so bidimensional mode. And it's also a good way of trying to understand this, because usually once we'll have the sound waves transmitted to the organs and received back, we'll basically see as a slice from the image that we want to see. It will not be the full size of the organ, so there will be always like different types of slices depending of the position of the transducer and depending of the area that we are scanning. We'll have slices, and that's why it's always important when we are scanning to scan from multiple planes, oblique, transverse, sagittal plane, so we can assess the size, the echogenicity and the structure of all the organs that we are scanning. And as I was saying, everything is represented in a gray scale on the screen. Now the B mode is the most common mode used in ultrasound. Yeah, so it's a major one, and we do have some major settings that we need to be aware, and something that we can work on to improve our image quality. When we discuss about B mode, we always need to discuss about frequency. Yeah, so the frequency represents a number of oscillation in 1 second. The waves that are transmitted from the transducer, they will be sent within the body in different amplitudes. And it's quite a good representation of how we can use the frequency and how the frequency needs to be used in order to get a better image and how everything is processed. Regarding the frequency, as I was saying, we do have high frequency waveforms and low frequency waveforms. What this means? Simply saying, with a shorter wavelength, we'll have a shorter penetration, but we'll have a good resolution. And it's the other way around with a low frequency, meaning that we'll have longer wavelengths, longer penetration, and we'll have a bit of a reduced resolution, a poor resolution. Yeah. So what this means and why the frequency is really important. So imagine that we do have those 3 points. So if with a high frequency, everything will be covered by the sound wave in really narrow and short spaces, we'll see all those 3 points in really good detail. And why is this so important? Imagine that if we are scanning the liver and if we have an isoechoic nodules, it's really important to have a higher frequency so we'll not miss any of those changes within the liver structure. Yeah, so we'll have a better resolution, but the penetration, it will be a bit lower. Now, compare with the lower frequency it will reach a bit of a deeper structure, but exactly in the comparison with the high frequency. So if we'll have those 3 points, let's imagine that those are 3 nodules. Every time when the wavelengths will just go within the liver, we might miss big parts, or we might miss entirely those 3 points, those 3 nodules within the liver structures. It might go deeper, we might see the deeper structures a bit better, but we might miss the, let's say, the nodules, the structures that are quite subtle, and we might need a higher frequency. We always need to adjust the frequency depending of the dog size, the patient size. If we consider high frequency, small to mid size patients, if we consider lower frequency, it's really good for for bigger dogs, but we need to be aware that we might lose some of the details. This obviously depends on the capabilities of the ultrasound machines that we are using, depends on many other factors, if the patient is sedated or not, the position that we are scanning, but realistically speaking, we might miss small lesions with a lower frequency. Yeah, so we have advantages and disadvantages depending on the frequency that we are using. As I was saying, it's really important all the time to keep in mind that a lower penetration, it will allow us to see the structures that are deep within the the abdominal cavity within the body, and a higher frequency will give us a better resolution and it will improve our image quality. Yeah, so I have placed here some examples of how this can be seen on the ultrasound. So we see here the high resolution. We do have a good image quality, but as you can see here, we do have a lower penetration. And if we assess, so most likely the hepatic vessels, so we can see the hepatic veins are going quite deep into the caudal vena cava, and we can see that we don't see the deeper structures that well. Compare, for example, with a lower resolution, we can see the wall slightly better and we can see the architecture a bit better. Okay, so this depends, this is really dependent of frequency, and it's something that we always need to be aware. And one thing that is more important, I've heard some people in a way confusing a bit this type of terminology. So depth and frequency are two distinct settings. They are connected, but they are separate settings. Yeah. So frequency, depends of the probe, and we have the depth that is that it's machine dependent and user dependent setting. Yeah. So when we'll discuss about this in the next slides, but I just want to make sure that we are emphasizing those points. So depth will obviously allow us to scan a bit deeper, and we need to adjust the frequency depending of the depth, but there are different terms that we are using. Another really important part of the ultrasound scanning, and a really important part of our settings, is represented by the focus position, by the focal point, which is basically the interest point. Yeah. So if we consider that we want to scan, for example, the adrenal gland, the focal point will need to be set at that level. Means that the ultrasound beam will be mostly concentrated in that position. Yeah. So this will allow a better resolution, and it will concentrate the image there. And it looks exactly like that. Yeah. So focal point, depending of the machines that we are using, the ultrasound machine, you will have it presented as a narrow tip, you will have it presented at different other shapes, but most of the time you will see it here, and it will be presented on the machine. You will have it at a focus point or under different names. And that's why I was saying at the beginning that it's really important to know our machine, know and learn the settings. Yeah. And check also the ultrasound manual of the machine that we are using, so we can make sure that we are seeing those things on our screen and on the machine. Now, depending different type of machines, they will have different type of settings. Some of them with newer technology will have the autofocus. Yeah, so everything will be assessed in zones. We also need to be aware of that. Yeah, it will improve the image quality and make the things faster, so we'll not have a focal point. Now, when we discuss about the frame rate, frame rate is also really important in image formation. So the frame rate is a number of images that are generated per second. Yeah, and it will give us that type of smooth, nice picture on the screen. We need to be aware that the frame rate can be influenced by multiple factors. Yeah, and it's something that I always emphasize, how all those settings will affect the image quality. I have put here an example. So for example, we have, I'm not a cardiologist, I'm not going into this, but it's just a bit of an example how the frame rate can help. So for example, I was using, if we are working in emergency or anything like that, when we have cases of panting, of tachycardia, tachypnea, things like that, we can adjust the frame rate and it might give us a bit of a slow motion image, so we can see some other changes that we might not see if the dog is panting, if everything is moving really fast. It will reduce obviously the resolution, so we will not have the same type of resolution and we might miss some area. But if it's something that it's let's say that we need to do it straight away, it's better just to know those things and we can have a bit of a play with those images, so we can understand a bit better the frame rate. So what will affect the frame rate? So here we have an image with a normal frame rate. So it's exactly as we are seeing when we are doing a scan, and we can see the spleen here. And in the same time, when we have a reduced frame rate, we can see that the image is moving in slow motion. Yeah, so that's why I was saying, like, in some situation, it's not necessarily recommended, but it might be a good trick to remember if we have patients that will breathe really fast and we might not see anything and we think that we have seen something there, but it's no way that we can analyze that structure in a really fast period of time, so we can take a decision. We can change a bit and we can use some tricks so we can reduce the frame rate. And if you see here the difference between the focal point, yeah, so we'll have one focal point and we'll have 3 focal points here. So usually the frame rate will be affected by multiple factors. If we have too much depth, so this means that if we are telling the ultrasound machine to scan at 10 centimeters deep, so obviously the frame rate will be a bit slower. The image will take longer to be shown on the screen. Basically, all those ultrasound waves that we are sending at 10 centimeters deep, it will take another 10 centimeters to go back on the machine, and the machine will need to process that. Yeah, so it will take longer for the machine to process all this information, and we might see a bit of a slowly image. The field of view, if we have the field of view as it is here really wide, it will also affect the frame rate. Yeah, exactly with the same principle that I have said earlier. Being a large area that we are scanning, it will take longer for the machine to process all those images. Yeah? Multiple number of focuses that I was showing here. When we are using Doppler, but again, I will explain into the next with the next presentation. But when we are using the wide sector angle, so the machine will take a bit longer to process the image, and the frame rate will be a bit slower. Yeah, and the zoom magnifying the image, it will also decrease the frame rate. Yeah, so always make sure that if we see the image that it's a bit slower, try to check those type of things. Yeah, so I will say the most common ones will be the focal point. So if we have more than one focal point, the frame rate will be slower. So always try, this is the most common thing that I have seen. Also, if we have the field of view, if it's really wide, obviously the resolution will also decrease in a way and the image will be slower. So I will say that those are the most common things that I'm seeing when we have an image in slow motion. It doesn't mean that the machine is broken. It means that it's taken a bit longer to process everything, all the information. Okay. Now, when we discuss about the dynamic range, it's has, sometimes you'll see it under different names on different type of machines, different type of manufacturers. They can use different names for the dynamic range. So simply saying, I'm always keeping this in my mind, dynamic range defines the total number of grayscale scales displayed on the monitor. Yeah. So if we are looking here, when we are assessing the abdominal organs, we can see the dynamic range that it's set at a 155 level. Yeah, and also different type of machines will have different type of ranges for the dynamic range, for the dynamic range. Yeah, so different type of values. And if we look in the second image, this is a cardiac movement. Yeah, is a cardiac image, but you will see that it's set at 100. Yeah, so if we consider that the dynamic range defines the total number of the grayscale displayed, we need to keep in mind that for abdominal organs, for the parenchymatous organs, dynamic range should be set a bit higher. And if we are assessing, for example, if we are doing cardiology or we are assessing the bladder of the blood vessel, the abdominal blood vessels, it's better just to decrease a bit the dynamic range so it can give us also this contrast between the anechoic areas and the echogenic areas. Yeah. Some suggested values that I tend to use, but this again, one thing that I forgot to mention, keep in mind that we all have different eyes and we all see the shades of gray differently. Yeah. So what is good for me doesn't mean necessarily that is good for everybody. Yeah. It makes sense for me, but we always need to have a bit of a play with the shades of gray as well, and we'll discuss a bit later in the webinar. Some tip for the dynamic range. As I was saying, a higher dynamic range gives us more information about the echo pattern, so it's good for the parenchymatous organs, spleen, liver, everything that means abdomen. Yeah, for images of the vessel, a lower dynamic range it's preferred. Yeah, but again, this sometimes depends on the patient, but those are some general tips that I'm using when I'm doing a scan. Now, one thing that it's used more common, and I think that everybody knows about the gain. So the gains is basically the amplification of the echoes reflected. Yeah, it will give us more brightness on the image. And if we are assessing different type of images, for example, as this one is, for me, it's too dark. So I would like to be a bit brighter. Yeah, but again, we need to be aware that if we decrease the gain or if we increase the gain, it might mask some small changes. And one thing that we don't want is just to miss some certain changes, like small nodules, small bits within the organ structure that might give us, that we might consider that is normal, but actually they are there. So always try to set the gain at different values. Again, keep in mind that we might also need to have a bit of a play with the gain until our eyes will get used with that type of gain. And depending of the structures that we are scanning, depending of the size of the patients, and depending of the area that we are scanning, we might use different type of gains, and it's something that we might adjust when we are doing the scan. Yeah. So again, what I'm trying to emphasize is that the gain is eye dependent, and we all need to assume that we find the best level of gain that will give us the most information from the area that we are scanning. In a similar way with the gain, we have the time gain compensation. Yeah, so the time gain compensation will just basically adjust the level of gray at certain levels. And if we consider, all the machines have those settings. So those are the options that we'll see on all the ultrasound machines. Yeah, even if with some new ones, with some modern ones, you'll see them by touch screen. We'll see them on the touch screen, or there will be a bit of a, in a way, digitalized. Yeah, but on most of the machine, you will see the typical appearance of the time gain compensation curve here, the buttons here. So what this means that we'll increase or decrease the level of gain, so the level of brightness at certain level, and everything will go in a line. Yeah, so we can see in a central position, and we can see the difference when we are decreasing the gain proximal. Yeah, and we'll increase the gain distal. Always try to have a play with this, but again, we need to be aware that I have seen some examples where the gain was increased at the near field, really proximal, and when we scan, for example, small structures, consider adrenal glands. Yeah, if we have a nodule and we have a really bright area here, we might miss small mineralization, small changes on the adrenal glands. Yeah, so always try to adjust. You can also, it's something like general gain. It's something that you need to play with just to get the best of your ultrasound machine. And again, it's something that we need to be aware when we are scanning, that playing a bit with the time gain compensation and improving the gain at a certain level might give us more information than actually leaving everything as it is. So try to always have a play. You cannot break this. You can only bring it at the same level as it was. So always try to have a play with the timing and compensation. Yeah, and it's just some examples. Those are after let's say basics principles. It's again from cardiology, so I do apologize to all the cardiologists if those things are not used that much anymore. But like a reverse C, it was basically used so we can decrease, it can improve a bit the contrast, and we can see also those changes. Yeah. And another setting which is similar with the timing gain compensation is called lateral gain compensation. You will not find this on all the machines, but I'm always emphasizing this because it can give us a really good quality of the image. So compared with the time gain compensation, it will act basically at a different level, in a different type of line, if that makes sense. So instead of going as with the time gain compensation, just basically going like that, this one will improve and it will increase the gain vertically. Yeah. So from the lateral part of the area that we are scanning, so we can increase and decrease the resolution at different levels. It's really good if we want to see a bit of a more structural changes. Sometimes if you have it on the machine, always try to have a play with this, because it might give us the detail, might improve the image. And again, it's always good to be aware that those settings, that we have those settings on the ultrasound machines. And different type of settings, you'll see those with different manufacturers under different names. So make sure that you're always checking. And if you have something on the ultrasound machine on the screen that you don't actually know what it means, try to look in the user manual, try to check with the people that are supplying those. They might give you more information about what those things means. Yeah, because technology is developing, and with the newer products, we do have different other options, and we also need to be aware of this. Okay. Other common settings that are used on when we are scanning, the depth, as I was discussing when we start the webinar. So adjusting the depth might give us a bit of a more information about the deeper structures. Yeah, as I was saying, it's different than the frequency. So always make sure that if we increase the depth, and if we have a mid-sized to large-sized dogs, if we increase the depth, we also adjust the frequency so we can get the best from our ultrasound machine. Yeah, so increasing the depth does exactly as the name is saying. We'll see better the deeper structures, and if we decrease the depth, we can see better the superficial one. Yeah, so depending of the field of interest, we can have, and the size of the animal and the depth of the structures, having a play with the depth might improve the resolution, and it might give us information that we might miss otherwise. Yeah, and as I was saying here, we do have this relationship between depth and frequency. Yeah, so always keep in mind this. Yeah, so bigger depth, we need to lower the frequency, and the other way around, with a higher frequency probes, we need to have a bit of a smaller depth. Yeah, so it will give us a better resolution and a nicer quality of the image. Field of view, as I was saying initially, all those most of the settings will be connected. Yeah, so field of view stands for the FOV stands for the field of view. Again, we'll need to be aware how this is shown on our ultrasound machine, and under what name. Yeah, so usually some settings, even if it doesn't sound that important, the field of view, it actually plays a big role into our image quality. Yeah, so we can make the field of view bigger, basically to have let's say, to get all the kidney into the view. We can make it a bit smaller, so we can actually concentrate a bit the ultrasound beam at a certain level. Yeah, most of the ultrasound machine will allow you to adjust the field of view. Yeah, to focus basically on specific regions, and this means that it will improve the resolution and the frame rate. Yeah, it makes sense, because if we have a smaller field of view, okay, as it is here, it's a bit easier for the machine to receive all the information and show us all the image on the screen. The other way around, a huge field of view, it might give us more information, but we might use some of the details of the area that we are scanning, and the frame rate will be a bit smaller, means that the image will be a bit slower. Yeah, and also the field of view will be different with different types of probes that we are using, and it's something that we also need to be aware. Yeah, we do have the zooming, and we also need to be aware about the specific relation between the zooming and the image quality. Yeah, so we do have a few types of two types of zooming basically in the ultrasound. So we have the post-processing zoom, which will amplify which will increase the image size after the image is acquired. Yeah, and we have with the more advanced ultrasound machine, with the more modern ones, we do have the pre-processing zoom. Yeah, which will show us live when we are scanning, which will increase and will focalize on a certain area. But we need to be aware that sometimes if we are zooming too much, obviously the resolution will lose, depending on the capabilities of the ultrasound machine, the technology used, and also of the area that we are scanning. Yeah, and different type of zooms, they can be useful for different type of areas, and it's something that we need to be aware that sometimes if we are zooming too much, we might lose small details and we might not see. But most likely everyone have seen that when we are zooming that much, we just basically lose some of the details that are quite important for the abdominal ultrasound. And I think another thing that worth mentioning, and we need to be aware of it, is the persistence. So basically, simply saying, try to keep everything simple. So our goal when we are scanning is just to have a good image, to not miss anything, and have a differential list of diagnosis at the end. Yeah, so persistent will help us making the image a bit smoother, a bit nicer, and it can be used in B mode and it can be used in color Doppler. Yeah, when we are discussing about higher persistent, we can also have a play with this. So we'll have the settings, the buttons on the ultrasound machine. We just need to find it and need to know which one represents what. And basically, when we increase the persistent, we are using mostly, just keep it simple, for the abdominal organs. Yeah, if we are using for the cardiology, and if we want to see also, let's say it was mostly used in humans. But if you are doing like a let's say some fetal measurements, or if we are doing this type of reproduction scanning, also have a think about the persistent, because it can improve those type of details. Yeah, and as I was saying, increasing the persistence will create a smooth image, so it will reduce the noise. With a decreased persistence, it might give us a better motion, but it might cause a bit of decrease of the resolution on the screen. Yeah. And now two things that are actually really important, and all of us, we need to be aware of those, and all of us, we need to try and find the shades of gray that we like, and that's the shades of gray that actually makes sense to us. Yeah, keep in mind, it's really important. Keep in mind that we all see the things differently. So when we are using the gray map, we do have different type of shades. Most of the machines will have multiple grayscale maps. So if you have a play with your machine and you see that once you start moving the gray map, and it will turn, let's say, from really dark to a bit of a more gray and a bit of a brighter gray, and everything will change and it will make sense to you, just try to use that one. Try to use those presets, because your eyes will get used with those type of settings. But always keep in mind that what makes sense to you, it might be different for your colleagues. Yeah, and it's also really important. This involves also a good knowledge of the machine. How can you change those type of things? Yeah, because if some of us is scanning and I'm coming after, I might use a different type of gray, or if someone will scan after me, they might change the gray map because they like more, and they see the things different in a different type of gray. Yeah, so I'm always referring this to really small nodules, echogenic nodules, isoechoic nodules on the liver, regeneration nodules. Sometimes they are quite similar in appearance. If you'll have a bit of a play with a gray map, you might see it more obvious, or you might not see them at all. So if you have a bit of a play with the gray map and it will click in your head, try to use that one because your eyes will get used with that. And we also have the tint map. Yeah, tint map, it's in a way similar with the gray map. It will only assess the color map. Yeah, it will only change the color maps. So some of us, we might not see small structural changes in different parts of the organs of the body that we are scanning, and you might see that if you are changing the tint map, if you have a play with the tint map, it might make more sense to you. Some people will change the tint map and will make it a bit more bluish, a bit more orangey when they are doing FNA, so it makes sense to them. They will see the needle better. But again, always keep in mind that we all see the things different, and it's really important to know those settings, and it's really important to have a play with them. And once we establish that, oh, I can see those nodules a bit better, I can see those structural changes, those let's say those areas a bit better with a different tint map and a different gray map, try to use those ones. And it's exactly as in this famous picture. So we are all seeing the things differently. Well, to be honest, in this one, if we start seeing people in a green color, we might also want to have a check for this. It might not be right. Yeah, but just keep in mind, it's a simple way of saying that we all see things differently, and what makes sense to us might not make sense to other people. So always have a play with the ultrasound machine. Yeah, and in the end, we have some key points that we always need to remember. And I think the most important one, it will be to know your ultrasound machine. Yeah. And once you know your ultrasound machine and you'll know where all the buttons, all the knobs are, all the settings are, you might make your life easier. I know that sometimes we might be quite pressed with the time, we might not have enough time, but if we consider that we want to do a good abdominal scan, a good cardiac scan, or any type of scan that we are doing, we all need to know where the settings are and what those settings are doing. Yeah, scan systemically. So I always advise people, if you have a protocol, sometimes in different books you'll see different type of protocols. People that are scanning, they will use different types of protocol. The goal, it's always just to assess as much as you can, to cover as much as you can, to cover everything if possible. Yeah, and if you don't miss anything and you have a differential list of diagnosis and it just makes more sense to you, use your own protocol. Now also the anatomy, try to get used with normal changes within the anatomical within the anatomy. Yeah, always use multiple planes and try to correlate everything with the clinical science, and always practice. If we start thinking with all those settings, if we start thinking that, oh, if I'm doing those type of settings, I might not bring anything back, try what I was using. Sometimes it's when I'm looking at different types of machines, sometimes I'm just taking a picture with how everything looks and playing a bit with it. And after that, if I don't like it, I will bring it to normal. But to be honest, if we all remember all those type of settings and we all learn our own machine that we are using daily, we'll be able to get really good images. And obviously clinical work will be improved. Yeah. And that was all from my side. I hope it was useful for everyone, and I hope that you learn something from this. And if you have any questions,
yeah, please do pop them in the chat box. Thank you, Cristi. That was really interesting. And I think your passion for encouraging everyone to familiarize themselves with their ultrasound machine, get to know what the capabilities of your machine are is great. And I think that's something we've discussed quite a lot about. Actually, you can do so much with the ultrasound machine, but you do need to familiarize yourself. And if you don't put the time in, then you won't get that quality of image that you could do. I've just put into the chat box for everyone that's attending the link to the next session, which is on
the amazing, thank you.
Yeah, which is a week on Tuesday, 28th of October at 7:30 p.m. And that's the next steps, where Cristi would also talk about further details, including Doppler. So if you have got any questions, then please pop them in the chat box. Someone's asked if the slides are going to be available. We will share the recording of this on our YouTube, so you could have that access there. And then another question is, what is your advice for identifying needles when doing ultrasound guided FNAs or aspirates? Sometimes it looks like a really nice white line, and others, they can't see it at all. Maybe it's just the tissue moving slightly, but the needle can't be visualized. So do you have any top tips for FNAs and how to visualize that needle?
Yes, so with the FNAs, and when we are doing FNAs from anything, from a lesion, from the organ, so we always need to be familiar with the angle. So basically, there are some general principles that are used with FNAs. So we need to learn how to place. We need to learn that when we are doing FNAs, different angles where we are placing the needle basically will be seen differently or not seen at all. So I think if we learn the protocol with the FNAs and the correct angle and the correct position of the probes and what we need to do and how to keep the probe and place the probe when we are introducing the needle, it might help us seeing the needle. And some other tips, as I was saying, the gray map, the tint map might always emphasize a bit more the needle, depends of our eyes, depends also on the focal point. I was reading some studies that sometimes it can depend of the material that the needle it's all the materials from the needles. Yeah, so
Okay.
there are multiple ways of improving the image, but I think the most important is the angle and how we are holding the probe and how we are doing the FNA. So the technique that we are using, yeah, because if we know the technique and we see where the needle is going and we know how to maintain the angle, it will do the job really.
And so for our partner practices at VVS, anyone that is, we do FNA CPD, so we can teach people and we've got resources around that. But for anyone that's not a partner practice with VVS, do you have any recommended resources for fine needle aspiration to look out for, or is it a case of doing a bit of research? Do you have anything off the top of your head that you can recommend?
From the top of my head, at the moment, I don't, but there are lots of books about those things and lots of resources and that everyone can use.
Fabulous. Someone has asked the grey map or the tint map. Where would you find that? Is that commonly in your settings? Where would you typically find that within an ultrasound?
So depends of the machine.
Okay.
Some of them, the newer ones, they will have it. You'll have the newer ones. I mean, the one with the touchscreen. You might also have a look on the touchscreen, and you might see the settings there. But most of the time, you will see it that you will need to have a bit of a play with the buttons, but depends really on the machine. Yeah, some of them they have it. Most of them they have it. Some of them they don't. But I think depends of the machine.
On the
Yeah.
machine. So look at your individual machine. Okay, brilliant. We've got a nice question. So saying thank you for the webinar and any tips for vet students getting started with ultrasound skills, where to make a start. And I think probably familiarizing yourself with the ultrasound machine and all of the settings and capabilities and following kind of what you've gone through today would be a really great start. But I'm sure you've got other tips.
Yeah, I think it's exactly what you have said. So just basically just to get familiar with the ultrasound physics, with the anatomy, it's quite important with the knobology and what the machine can do, and also to practice. And there are lots of amazing books, and everyone knows that there are 2-3 major books that everyone is using all the time. So and there are lots of resources, lots of lectures, lots of courses that people can do. But I think if you're really passionate about imaging and you learn and you practice constantly, I think you'll get better and better with practicing and learning more and more.
Probably selecting the right model to practice on to start with. A big dog over kind of 30 kilos, it's going to make yourself it's more challenging for yourself. So probably a nice dog, I don't know, 8 to 15 kilos that's not too overweight would probably be a nice dog model to start doing ultrasound on first time.
Yeah, that's also a good point, because it can be a bit discouraging if you have a huge Labrador, a huge Golden Retriever, and you don't see much. And always keep in mind that every time when we are scanning, I'm always remember people that deep-chested dogs. Sometimes it's really frustrating, and people they get a bit like everything is between the ribs. So again, it's something that we need to be aware: anatomy, practicing, and just getting used. And if we don't see some things, it can be dependent by multiple factors, but I think practicing and learning constantly, it will definitely make the things easier and better for us.
Yeah, similar to, you know, when you're doing neutering, you wouldn't go straight for the big dog spay with all the fat in its abdomen. It's not going to be the nice experience. To do the same with ultrasound. Then finally, someone has asked, oh, there's actually a few more questions, that when they freeze and acquire an image, the resolution really drops. Is that user error, or is that the machine, basically that static image never looks as nice as that moving image?
Yeah, I mean, when we are doing this, try to make sure that we are not saving like a loop. So every time when we are saving an image, if it's not a live image, basically it will miss some of the, we might miss some of the changes. Yeah, so you're absolutely right. Some resolution might be lost when we are freezing the image, but if you have a bit of a play with the trackball or with the touchpad, depending what we have on the ultrasound, you'll see everything in dynamic and you might see the changes there. But usually what we see live, it's completely different. So it's just basically like a river that it's moving, and it's you see it in a way live or on the video, and in a different way you see when it's just a picture. So small changes there might be missed like that. But what I'm advising also, it's always try to have a bit of a play with the trackball or with the trackpad, so you can move a bit the images and you might see the things that you are expected to see.
And top tip, if your trackball is not moving, if you've got one of the ones that's an actual ball, it's probably because there's ultrasound gel and hair underneath that. So make sure you clean it.
Give it a clean
that regularly. There's lots of information how to do that. And then a lot of people have asked if what books on ultrasound radiology you recommend. You've mentioned a few. Would you have any of the names off the top of your head?
Yes.
Otherwise.
Yes, so my favorite one, it's actually a new edition now. Penick and Danjou, everyone knows. So I think it's an amazing book to start learning. Regarding the physics and the principle, if we think about diagnostic imaging, I would say TRAL. It's one of the best. It's probably the best one that covers everything. Niland and Matun, it's also amazing. So, but I think the one that I found it when I was reading, and the one that I found that fits perfect with my needs, is Penick and Danjou, and the new edition focus more on multiple other pathologies. But I will say if you combine the Penick and Danjou and Niland and Matun, you will find more pathologies, and everything combined, it will give you a different perspective on the things. But those will be my top ones.
Brilliant. Lovely. I think that's all of the questions there that we have covered. So like I said, hopefully everyone can see that link through to the next session. It will also be included in the follow-up email that we're sending everyone that's attended, and you will get a CPD certificate coming over the next couple of weeks. So thank you everyone for coming along. I think we've kind of had record attendance over the course of the evening. Hope we answered everything, but like I said, there's a second session, and if you do have any burning questions ahead of the session on the 28th that you would really like Cristi to cover, please email us info@vvs.vet and let me know, and I can pass that on to Cristi, and maybe we can answer the question and answer, even if we're not able to add it all to the slides. But have a lovely rest of your evening, and thank you everyone for coming along and letting us take part on your Wednesday evening. So thank you, Cristi, and we'll see you all soon.
Thank you, Lydia, and thank you all for coming and joining the webinar. Hopefully it was useful for you, and any other questions that you have, guys, and we might be able to help, just please let us know. But thank you for the attendance, and as I say, I hope it was useful for you.
Thank you, everyone. Bye.
Thank you. Bye-bye, everyone.